Hey folks, it's Finn. I've been promising you a lower surgery update for ages because I'm currently having a few issues, and this is that catch up. Before I go on, I just want to warn everybody that this is a lower surgery video. I will be talking about my genitalia, I will be talking about peeing and general intimate things to do with down there. So if that isn't your bag, do feel free to navigate away. Use your own discretion here, please. For those still watching, you've been warned. Right, so unfortunately, yes, I am having some issues. To recap, a year ago this January, I went in for stage 3 lower surgery, final stage, the ping stage. Unfortunately, when they went in to do it, they discovered some problems with my urethra. What had happened is I developed, they called it a cul-de-sac, where you have like a little extra piece in the urethra, so it's like a little outpouching. And although I wasn't having any symptoms from it, the chances are I would have done down the line, and they don't like to put in the erectile device if the urethra is still having problems. So they corrected that. Unfortunately, that correction then went wrong. I had lots of infections, so much so that they had to take me back in, and it couldn't be fixed because the infection was so bad, and they had to undo my urethra completely, and I had to return to peeing from underneath my penis, which was absolutely soul destroying, as you remember. I had that then fixed again in October after having a period of time undone. I was re-hooked up last October, and so far things had been fine until, I'm not quite sure, to be honest, when exactly it started. With everything going on around mum, I don't think I was paying a huge amount of attention to my own well-being, and so I can't pinpoint when it exactly happened, but I just started noticing that at the end of peeing I was getting a kind of like pinching pain, and there was some kind of pain in my lower abdomen. Not pain, but discomfort. It was like a very, very watered down feeling of what I was feeling last time, and that sent alarm bells ringing. And then dripping has become worse, and I've gone from like post-void dripping a bit to in-between dripping just randomly now. It's funny in that it comes and goes. I get a period of days where I've got no symptoms whatsoever, but then suddenly I'm frequently going to the toilet. I'm up 3 or 4 times a night. I'm going on an hourly basis. And I think it feels to me very much like there's a problem there, and possibly then because there's a problem I'm then getting little mini infections. I'm taking the D-Manus, which I've mentioned before, to keep any infections at bay. So I decided I had to contact Mr. Christopher just to see what he says. So I saw Mr. Christopher this week to discuss options. He's not overly concerned that it's an emergency right now. If it gets worse, obviously he'll take me in. But he's advised me at the moment to stick with my stage 3 slot. I don't have it yet, but hopefully I will soon, over the next kind of month, a couple of months at the most, I hope. Because it may well be that he doesn't find anything, and if he doesn't find anything, he can go straight ahead with the erectile device. Whereas if he books me in now for a cystoscopy to have a look at my urethra and he finds that it's okay, then he can't do stage 3. So does that make sense? So we're going ahead with the stage 3 slot as soon as available. Now Mr. Christopher says it's one of 2 things, or maybe a combination of 2, or actually 3. Hang on a minute. It could well be that I'm just going to be drippy. We don't, as trans men, we don't have the muscle that's underneath the scrotum that helps to push out the last bit of wee. That's why a lot of trans men are kind of suggested to kind of like run your finger up your phallus just to drain the last bit out, which I do. I never used to have this issue. I do that, but it's more than that because, as I say, it's doing it in between. So it could be that I'm just one of those people. He said that also some people do find that they have a lot of bladder infections because their bladder isn't coping with having such a long wee pipe. I could be one of them. So it could be that there's no issue whatsoever. It's just my body isn't reacting very well to having the long urethra and not having the muscles there, meaning I'm dripping. But based on the fact that I've had a history of a year peeing fine before stage 3 went wrong, means that there might well be a problem there. So the problems that could be there are either a stricture where it's narrowed somewhere, which is causing like irritation and making me want to pee more frequently, or what he calls a baggy urethra, which is basically where it's got bigger, so rather than being like that, it kind of dips there. So there's too much room and it's collecting and what have you. Obviously, all this is guesswork until he goes and has a look. If it is a baggy urethra, he can do what he did with the cul-de-sac, which is take the extra bit out, which slims it down. That then should fix the problem. If it is a stricture, it may well be then that he needs to take some skin from my mouth to widen that part. If it is both a stricture and a baggy urethra, I'm in more luck, because what he can do then is kind of where the urethra is baggy, he can kind of manipulate that to make it longer and fit where he's taken the stricture out. Are you following me here? So that I don't need the mouth graft. There's all different sorts of options. So the upshot of it is something's not right, but we don't know whether it's not right with the wee pipe or just my general makeup isn't coping with the new configuration. Me personally, I think that because my body's coped with the configuration before for a decent amount of time, it leads me to think that there is either this baggy urethra or a stricture. I'd guess out of the two, I'd say baggy urethra instinctively. Just because of the way it drips, and I can kind of, you know, if I go underneath and really push and drag my fingers up my willy and drain more out, you know, I can feel that's helping. It doesn't feel like a tightening, it just, I don't know. I'm guessing, aren't I? It's all very, very frustrating because, of course, if these issues are found when I go in for my stage 3 slot, they'll have to fix those before doing stage 3. Then I'll have to heal. It may well be that I have to be undone again and have a period of healing. Again, we're at a big thing of not knowing at all. So although I'm not in a huge amount of pain, it's uncomfortable. And of course I'm having to resort to using these again. Not attractive. Obviously the weeing through the night is doing my brain in as well because I'm not getting a constant night's sleep, combined with frequent waking up because of needing to pee and the carpal tunnel syndrome. I'm in severe sleep deprivation right now. It's really, really bad. So, don't need this really, but it is there. I can't do anything about it. It's happened. And all I can do now is hope that they get me a stage 3 date as quick as possible so that this can be looked at. He said that sometimes if the urethra's a bit baggy, they can actually manipulate it with the erectile device, and that squashes the urethra a bit, so it kind of solves it. So he's given me lots of options that could happen, but again, not going to know till he's gone in there, and I'm not going to know till I wake up. The good thing is Mr. Chris was going to do it regardless. I've asked for that, so it's just a case of waiting now, isn't it? It's just tough to deal with all this. It really is. I just feel a bit cross with the world at the moment, which is understandable, but what can I do? What can I do? So yeah, not great news, but as soon as I get a date, I will let you know. So that's it. That's your news for the week. Finn is back to wearing man pads. I'm such a catch. Thanks for watching, everybody. Take care of yourselves. Have a good week. See you soon. Bye-bye.